Welcome to this inaugural episode of Cancer Buzz TV, the video podcast channel of the Association of Community Cancer Centers, ACCC. I'm your host, Summer Johnson. On this show, we'll bring you new perspectives on the emergent issues in cancer care you need to know. ACCC's 2021-22 President, Krista Nelson, took the helm in March at the association's virtual 47th Annual Meeting and Cancer Center Business Summit. Krista will lead the organization for the next year as oncology professionals work to tackle critical issues in cancer care post-pandemic. But she's been working to advance issues for the oncology community for many years as an ACCC member. Krista is the Program Manager of Quality and Research, Cancer Support Services and Compassion, and an oncology social worker at Providence Cancer Institute in Portland, Oregon. We asked her to join us today to tell us about her theme as president, which will guide ACCC programming over the next year. Krista, it's so nice to have you here today.
It's wonderful. I'm really excited to be here today.
Your president's theme is titled Real-World Lessons from COVID-19, Driving Oncology Care Forward. You've identified 3 key lessons to focus on. Let's dive into those. The first being that health equity and social justice are critical drivers of quality cancer care. And as an oncology social worker, can you share what you're doing to reduce disparities in your home community of Portland?
Yeah, absolutely. And thank you for the opportunity to address this. I think this last year, we're all becoming more aware of our own bias and how we're looking to improve everything, access to care, the way that we provide care, all of the different avenues, and also trying to remove some barriers so that there is health equity. As a social worker in my own clinical practice, one thing our team has done is we have just a couple of people, I'm in Portland, Oregon, of color on our team, and are really looking to branch out and try to incentivize students of color to come in for internships in this next year with our local university. And I think one of the barriers is we would love to have a Black social worker join our team, and we don't have a Black social worker to sort of support them through the process of being an intern and being a student of color on our team. And so one innovative way I think we're looking at expanding that resource and becoming more attractive to people of color is looking for a national resource and looking to provide additional supervision out of our site, because we unfortunately are limited in our diversity within our team.
Krista, COVID-19 brought national attention to the increased risk that Black Americans, Latinx, the elderly, and other underserved patients face in many diseases, including cancer. Your cancer program is in downtown Portland and treats a high percentage of these patient populations, including those who identify as LGBTQI+. What's your program doing to improve care and better meet the unique needs of these patients? And in your opinion, what should be done to move the needle on a national level?
I think one of the saddest realizations is when I look at the people who are intubated in our hospital or on ECMO because of COVID, the sickest of the sick. Unfortunately, most of those patients are brown and Black. And so that right there is staring in our face as an issue that we're obviously not addressing or supporting patients of color preventatively. When we look at cancer care and COVID and how we support these patients, I think we have to start with ourselves. I think there's been a lot of learning within our community and our country this past year about our own biases, but then also looking at, who are we partnered with in the community? We're spending a lot of time looking at our community partnerships, organizations that specifically focus on advocacy of healthcare, access to healthcare for minority populations, and really trying to make sure we're removing barriers, transportation, financial, health, just looking at ways that we can provide more equitable care for all people of our community. I think the other thing we can look at is what processes or barriers are we do we have in our system that we're not even aware of? And I think one thing, one learning or one recommendation I would have for different cancer centers, and I think something we're looking at doing is, do you have people of color on your patient advisory groups? Do you have those organizations that represent that group at the table, helping you look at programs that you're developing? Especially now we're talking about healthcare screening because the risks of those going down through the pandemic. How can we reach out to these different organizations and provide support locally? We're partnering specifically even with the national campaigns with the American Cancer Society to look at improving screening post-pandemic.
The second lesson learned in your president's theme is in delivery of high-impact, comprehensive cancer care services that require innovative care models with measurable return on investment. Patients with cancer and their families find supportive care services like social work, financial navigation, and nutrition critical, yet many ACCC members shared that supportive care staff, including social workers like yourself, were among the first furloughed or asked to take leave during COVID-19 because their services are not reimbursable. How do we address this?
Yeah, I mean, if I had a crystal ball, right? I think that is part of why this question is hard. This is something that our organizations nationally, all of those of us that do supportive care to oncology care, the people we work with, the patients, the providers, they absolutely, we feel valued and we know that our roles are important, navigation, but these are also, like you said, the first to go when money is hard. And I think what we know to be true, but we have been unable to sort of substantiate in a qualitative, in a way that's really people can get, C-suite types can get their fingers around, is what is the value of adding these patients? There's been many studies or support for these patients. There's been a ton of studies that look at, ER visits are down, just asking patients about their distress, alleviate some of their anxiety, making sure we're meeting patients early and connecting them. It reduces barriers. I mean, patients actually have to get to the center, their practice, to get treatment. So if you don't have someone helping patients get there, you wouldn't be able to give chemotherapy or treatments as well. So it's really kind of looking at the soft support, but finding strong fiscal opportunities for us to show our value and help build the business case for offering these valuable supportive care services. I mean, it's dietitian, it's a lot of different ancillary staff, and there is some disparity in how people do the work. Some people bill for services. Some people have found that absolutely is not cost effective. So it's really finding a model that supports our patients and really upholds the value of that supportive care. I mean, there's been a lot of evidence and experience in palliative care and it improving health outcomes by providing support for patients near the end of life. So I think we just need an opportunity to pull together experts from all over the community. There's people doing great things within our ACCC community, and really getting us all together in a room and trying to figure out how to best build that business case model.
And finally, the last lesson or focus point you have is a culture that supports professional well-being and resilience is essential to practice sustainability and both provider and patient satisfaction. How are you supporting not only your patients with cancer, but now also your colleagues who are exhausted by this year-long national pandemic?
Yeah, I think this truly resonates with me, and just by witnessing the suffering of this last, I know I use that statement a lot, but it is true. The suffering of the staff who's been showing up every day through this pandemic and putting themselves at risk and potentially their families as well. This has really been, it's heart-wrenching to watch the exhaustion of my colleagues, and it's almost like we're coming out, maybe emerging from the pandemic. We have these opportunities for vaccines, and we're still seeing a lot of COVID, and we're still feeling the impact. I really believe that we can't just suddenly go back to normal, that we need an opportunity to grieve what has happened and have an opportunity to talk as teams about things that are so hard and impact us in very personal ways. I think we had a team discussion. We have like a Schwartz Rounds meeting for our providers, and just yesterday we're talking in a Zoom meeting, and someone was talking about PTSD and effects of us, not just the patients who've been through the COVID, but of the healthcare provider teams. And one of the nurses, I thought quite eloquently, said, "I wish I was in the post part. I'm still feeling the traumatic part." So it is also that balance of sort of the rest of community is moved on, and it's still changed everything we do. I think even if we're talking about cancer patients who have cancer, and we look at COVID, even if that patient doesn't have COVID, everything about their care is impacted by COVID. The fact that patients can't have loved ones with them when they're in the hospital, near end of life, when they're getting a diagnosis or getting their first chemotherapy infusion, and that weighs heavily on our staff too. They are the providers. Everyone has stepped up and been extra support to the patients who have increased anxiety and sadness because they're going through this experience, feeling pretty isolated. And I think, a big part of that is our providers also feel isolated in this, and, have a lot of feelings about vaccines and wanting everyone to be vaccinated. And it's such a complicated issue. And I really do think we have to do something to honor or grieve what we've been through before we can move on.
It's a big job. We're grateful for the leadership and commitment you've shown over the years, Krista. Visit the ACCC website at accc-cancer.org/president for more on Krista's theme, including a monthly meditation series, informal coffee chats with Krista, and resources around health equity, psychosocial services, and building a culture of resilience for cancer care professionals. On behalf of all of us at Cancer Buzz TV, thank you for giving us your time. I'm Summer Johnson.